Thank you, Mr. President. And I'm really, really grateful to have served on the Human Services Committee, and I want to thank Senator Hoffman and the rest of the members of the committee for the incredibly hard work that we put in. The stories that we heard were harrowing, but also, I mean, some of the most incredible work that this legislature has done happened in this committee. And I said this when we passed our bill out of committee, that I wish people paid as much attention to the deeply important, but maybe boring because it wasn't, there wasn't conflict injected into it, work that we did in the committee, because it matters. Two pieces that are so important to me is the elimination of the MAEPD, or the reform of MAEPD, which is the Medical Assistance for Employed Persons with Disabilities. This program has existed for over 20 years, but we've essentially created a tax on disability. People who are on MAEPD are paying taxes, and they're paying for other insurance like Medicare or private insurance, and then when they want to access medical assistance, when they want the supports and the services through medical assistance, they have this one avenue, and we charge them to access it. And so in this bill, we eliminate the asset limit that force people with disabilities to live in poverty. We don't allow them to accrue money, savings, houses, to buy vans for accessibility. We expand eligibility for Medicare savings programs to all recipients who are dual eligible for MA and Medicare. And it ensures that those who have been disenrolled due to the high premiums can re-enroll without penalty. The testifiers in committee were so incredible, talking about the important work that they do and the important services that they receive on MA, and how this program, though it has offered a pathway to people to work, has forced them to live in poverty. And we get to eliminate that disability tax with this bill. We also get to eliminate the parental fees. The Tax Equity and Fiscal Responsibility Act, I'm going to put that in quote, or TEFRA, it was to provide a pathway to medical assistance for families who have children with disabilities that require a high level of support, and they don't qualify based on income alone. But these parental fees were so high, that many families whose children met the high threshold often would forego the programs, cash out 401ks, quit their jobs, sell their cars. These fees were driving families with children with disabilities into poverty. And I'm just going to read two quotes here, and I have an incredible constituent who has been an advocate for this for so long, and I want to thank her and all of the parents who have come back to the Capitol and the legislature over and over and over again to tell their stories. We used to be a 2-income family, but I quit my job because it didn't make sense for me to keep working when most of my check went straight to TEFRA. How does the state win when parents leave the workforce? My family paid over $18,000 a year in order to access TEFRA, and that is on top of what we pay for private health insurance. The disability tax is real. With this bill, it is no more. And I'm so incredibly grateful that these provisions have been included in this bill, that we have done this work, because we have made disability justice a high priority in this chamber, and I'm so proud of the work we have done. Thank you, Mr. President.